A resident of Bartica whose identity will be concealed upon request on Friday decried the blatant disobedience of the curfew measures by some of his fellow Barticians.
I feel that people need to do much more than they are doing when it comes to protection wearing a mask and especially social gathering. And there are lots of people who are breaking the curfew rules. I think, not so sure, the COVID-19 group, they are doing quite a lot. I think their hands are filled, but I also think that they need much more assistance. They need more help.
The residents suggested that stricter penalties should be imposed to curb deviant behaviors.
I think the curfew should be implemented for another month or so, and there should be more severe penalty for persons breaking the COVID-19 laws.
On the heels of that complaint, Nightly News reached out to the Divisional Commander of Region 7, Senior Superintendent Lyndon Lord, who disclosed that in excess of 20 persons are arrested and placed before the court on a weekly basis. Lord added that curfew violators are fined $16,500 while some are remanded and later released. Some are also required to engage in 90 hours of community service depending on the magistrate's judgment. Meanwhile, the mayor of Bartica, Gifford Marshall, who also spoke with our newscast, stated that the recent passing of the latest COVID-19 patient on Thursday has left the town in dismay. 34-year-old Mohammed Abdul Khan, a popular Bartica businessman, became Guyana's 14th COVID-19 casualty after he succumbed while battling the disease in the COVID-19 intensive care unit of the Georgetown Public Hospital. Mr. Khan was a patient of the intensive care unit since June 23, having been transferred to the GPHC from the Bartica Regional Hospital on June 22. 6 COVID-19 cases have so far been reported in Bartica. The 5 active cases, according to Marshall, are still being housed in institutional isolation. Marshall stated that the Regional Health Emergency Committee, the municipality, and the police have been working in tandem to persuade residents to comply with the curfew rules. He divulged that a significant portion of the residents in Bartica depend heavily on the mining industry, and some persons continue to travel into the interior locations.
Interior presently is a high-risk area for our people. So we have been speaking to them, and we've been engaging the dredge owners, engaging those who provide transportation services to, and emphasizing the need for them to adhere to the public health advisories. And they will have to use wisdom in terms of the way they conduct themselves in the interior, because what is likely to happen is that they can return to Bartica to their families and bring the virus here.
Even though checkpoints for screening and testing have been established at strategic points at the borders, the mayor pointed out the major prevailing challenge in Bartica.
Some persons deliberately, avoid them and go through a next avenue, and we do not have the capacity to patrol our rivers 24 hours. We do not have the capacity to place persons all along the boundaries of Bartica, the border, to protect us in terms of see who's coming in and who's going out. So we need the support of all in this fight. And if persons deliberately try to avoid these checkpoints or screening points, then, like I said before, the office will happen.
Region 7, Cayuni Mazaruni, which Bartica is a part of, has registered in excess of 36 COVID-19 cases. Aranca has been labeled by the Ministry of Public Health as a hotspot in the region. Temika Rodney reporting for the HGP Nightly News.